Okay, so I'll do a couple of introductions and then we will be getting on with it. Welcome, thank you very much for joining us. I'm Marie Page, I'm the marketing manager at CareLineLive. I'm joined by Josh Huff, who's our managing director and founder. I imagine most of you will probably know, but just in case you don't, CareLineLive is an award-winning, all-in-one home care management software system. We specialise in working with home care providers. But what we're talking about today is also very relevant for people that are procuring software in care homes or in other settings as well. So CareLineLive helps improve efficiency, capacity and compliance by digitising workflows and automating processes such as rostering and payroll. Now, the way that our webinars work is that our presenter will normally talk for a maximum of 45 minutes. Josh may well be quicker than that. He's not known for waffling on. And then there will be a time for you to have questions and answers. I would suggest that as we go, you put your questions either into the chat thread or you can put them into the Q&A thread under sort of themed questions if you would like. And the question everyone asks is, can I get the notes afterwards and will a recording be sent? Yes to both of those. They won't be sent to you until next week, but you will get that recording. So if anyone is having problems seeing us, hearing us or whatever, please raise your hands, put something into the chat and we will attempt to deal with it. Otherwise, I'm going to hand over to Josh and he will present his slides on screen.
Thanks, Marie. Right, let me just share the presentation. So Marie, just to double check, I think you should be able to see that one now.
All good.
Perfect.
I'm going to go on to mute now.
Cool. Well, thanks everyone for joining. What we want to talk about today is buying software without the kind of buyer's remorse that people get when purchasing systems like this. We know that change management is a horrendous process for businesses like yours, and not just yours, but every business in general. So over the years that we've been doing this, we kind of learned some things and some tips and some tricks that help people, you know, and things that really we think you should be looking for when you're purchasing software. So as Marie said, my name's Josh. I'm the managing director of CareLineLive. I started the business by originally building an integration into a competitor's platform from 2012 onwards, before then starting to build out the complete management system that we have today from 2015 onwards. We now service over 600 customers and nearly 20,000 people using our platforms across the whole business that we've got every day. So hopefully I'm reasonably well versed now in what you should be looking for. So I guess we should start by looking at, why do you need software? We know that care businesses across either care homes, home care, etc., you don't necessarily want software, but you do need it. And so there's a couple of reasons why you should be looking at making a switch to digital platforms if you haven't got any, or looking around at other offerings if you have got something already. The idea is that software like ours and other platforms on the market will help you save time, reduce administration, and improve your efficiency across your business. And that doesn't necessarily mean that you have to be looking at how much profit that you're making, etc. It means that you could be spending more time with your staff, focusing on better quality outcomes, etc. It's allowing you to increase your capacity through giving you better visual indication of where you've got gaps, where carers' utilization isn't necessarily 100%, and makes processes like rostering and other things that you might do within your business, management of training, qualifications, etc., more efficient. Hopefully these packages will help you minimize travel time. Of course, this differs obviously in a care home, but particularly in a home care setting, minimizing that travel time becomes important, so there's more contact time with clients, increases your productivity, and helps you automate processes such as invoicing and payroll. You will not find, as far as I'm aware, a package that replaces additional software in payroll and accounting spaces. But what we can help you do, and what other packages will help you do, is integrate with those other systems to make your processes easier and simpler. One of the things I really love about the stuff that we do, and I know other people do things like this as well, is improving communication between not only the carers but also with service users, friends and family, etc. So, you know, what we're finding is things like by allowing family members to access schedules, to access their rota information and see that visits have been attended and maybe some photos during tasks, etc., they're able to communicate better with the service user rather than conversations continuously coming back through the care business. And that's reducing the noise that you're experiencing and actually improving communication between service user and family member. And then the communication that you have with the carer becomes better as well because they've got more information at the touch of their fingertips. Obviously, that helps because everything's all in one place. So it's reducing your paperwork and your filing, reducing errors and transcription issues through the electronic MAR charts, etc. And of course, increases the accuracy of information. But really importantly for everybody, it's a heavily regulated sector. By having platforms like this in place, you're able to evidence compliance, etc., much, much easier. One of our customers that we work with, North Shropshire Home Care, the deputy manager that's there said that she didn't realise how difficult paper-based systems were until they went digital. They've got more time to be focusing on management, admin and auditing, and our platform has cut a lot of processes down by at least 50% for them. And of course, as I said earlier, by having something like that, they're able to take on more packages. There are, though, a huge number of systems to go and look at when you're making a decision like this. From the research we've done, we think there are around 40 different home care management solutions in the UK, some of varying degrees of how much they look at patient welfare in terms of medication, in terms of observations, etc., and how much they focus more on running your business for you. Some are low cost. There's not, you know, all these extra bits that platforms like ours offer, and others claim to be integrated all-in-one solutions, but in reality, it's a series of connections between different platforms. So what do we think you should really be looking at from our experience? Well, of course, one of the first things to look at is the cost. How much is it costing you each month, and what value is that cost actually giving back to you? Just because it's cheap doesn't necessarily mean it's any good, but also the other side can be just because it's expensive doesn't mean it's not good either. There are plenty of systems to go and look at, and ultimately each different one will fit some of your requirements better than others. But let's not forget that if you're moving from another system, or especially if you're moving from paper-based to a digital platform, you should always be looking at making savings where possible. And by automating things such as your invoicing and your payroll, that should be reducing some of your cost. While you might not see that cost, it will certainly be freeing up capacity for members of your team to do other things, which of course is saving money. And the cost of not having a system is massive now. So we could take, for example, a paper-based care agency that has a fire. Suddenly you've lost all records. There's no compliance information anymore. But also, when you then look at digital systems, you should be looking at what's their cyber risk like as well. What policies have they got in place to help you? What security methods have they got in place to help you? Because once you've made the switch to digital, if something happens to your digital system, then you've got a problem as well. But what most providers will do, such as us, is we'll make sure that there's a series, or they should make sure there's a series of backups in place, that data is encrypted, and there are some reasonable security methods in place, such as two-factor authentication, that thing we all love to hate now. You should be looking at the future costs of what you're buying. So it's all very well and good looking at a platform and looking at it for your business today, but in 6-12 months time, when you expect to double the number of carers that you've got or double the number of clients, what does that software package then look like to you? Is it easy for you to understand what is the cost of growing your business? And then alongside that, obviously, as you get more invested in a platform, if in 6 months time you think actually you need something that's more powerful, what then is your cost of change? What's your ability to migrate? Can they help you? if they can help you, what migration path is offered. And that won't just be from the platform you're moving away from, but also the platform you're moving to. How can they help you? How can they ingest data? And how can they help you transition and carry out that change management piece that, as I said at the beginning, we recognize for businesses such as yourselves is extremely hard to manage. You should be investigating the feature set. Is everything included in the price? And what about future roadmap items? One of the things that we're always happy about is when customers ask us, so what sort of things are you looking at coming up with next? Because it gives our customers an idea of what we're doing to continuously improve a product. And when purchasing software, continuous improvement is something you always want to be looking for. And when we look at the feature set thing, the final point that you should be looking at is what cost of double entry is there, and is there any double entry required? So it's all very well and good that you might buy a system that does your invoicing, for example, but does it then talk to your accounts package? Because if it doesn't, suddenly you're double entering invoices into something like Sage or Xero, and you're investing more time when actually the whole point of this process was to try and make that more efficient and easier for you. When we look at cost, the hardest thing to try and work out is benchmarking where everybody sits in that landscape of what software solutions you're able to go and buy. Even when we try and benchmark against our competitors, it's almost impossible for us to always get a like-for-like comparison, because the way different providers look at charging is different across the whole field. Some of them are charging per service user, some of them are charging per carer. I like to think that by charging per carer, it makes it easier for you to understand the cost of growing your business. You know, if all of your carers' time is utilized 100%, to take an additional carer on to allow you to increase your capacity, you know what that's going to cost you in terms of how much you're going to be paying the member of staff, and also how much you'll be paying somebody like us to help you with that. What about the people that are sitting in the office every day? I would call those overheads, or non-revenue generating staff members. And so are you paying a cost for those? And if you are, actually, how much does that add to the cost that you're paying and your operating costs? Is everything included? Are there extras, things like for support, for training, for other features? Again, one of the things that I like to see is as much of a platform included in that one single price as possible, so that it's easier, as I said earlier, for you to understand what you're really buying. What about additional applications? Things like integrating with things like Sage and Xero. We know that there's still going to be a cost for you to purchase those, and so that should always be factored into your business when you're looking at costs like that. Is there a minimum fee per month? Are new features going to be rolled out free? And are there price increases? How regular? How much might they go up by? I think every business would be happy to talk to you about what price increases they've experienced in the past, so you can get an understanding of how that might affect you moving forward. And also, going on to the last point then, are there annual site license pricing options? So are there ways that you could agree with a supplier to pay a price for a year or fix it for a certain amount of time? When we talk about security, and we're talking about the risk and the cost of now moving to a digital platform, you really should also be investigating what external validations are in place and what security features does that software platform have in place. It's important for you to understand this, because it's important for you to know what risk there might be by moving to a digital platform. So, for example, ISO 27001 is an evidence of security. It's an evidence that your supplier is keeping a list of who they're working with, is keeping a list of backups, is auditing their devices and making sure that their devices are secure. But a further step on that is Cyber Essentials Plus, which most businesses will now have, especially if you're on the DSCR list like we are. And that's where actually your devices are externally audited as well. So people are looking at our computers on a regular basis and saying, yep, everything is up to date. All the security practices that you say you have in place are in place. And whilst every business cannot categorically guarantee that everything is 100% safe, by having these things in place, by having these standards, it's evidencing that the supplier that you choose has taken as much time and as much effort to keeping the data secure as possible. So that's where Cyber Essentials is obviously an independent testing for that, but also you should be looking for a platform that's independently penetrated, has independent penetration testing as well. And what that means is somebody has looked at that cloud-based platform and tried to hack into it and seen whether there are any vulnerabilities in the code. When you look at the real tech stuff, bugs and updates, you should be trying to understand things like, if people are saying to you it's cloud-based, where is it? Is that data stored in the UK? Can you prove it's stored in the UK? If there's bugs raised, are they prepared to fix bugs? Should you be talking to other customers or looking through things like Trustpilot reviews, etc.? How often do they update? We would expect regular updates to be rolled out across the software business because there are continuous security improvements that businesses can make, and also features and functions. As those get updated, you can then go and see, and you can get an idea of the momentum of development and the speed in which new features are being rolled out. Then looking at things like feature requests, how do you deal with that? If you have a certain request, do you email them? Do you call them? How's it viewed? Do you put it in a public forum where there's upvotes, etc.? Can you get an evidence of downtime? So obviously the minute you put stuff in a cloud system, if it goes down, what do you really lose from that? And how long has that been? What sort of integrations are there? So we're talking earlier about things like invoicing and payroll, etc. Does that system have a native integration with something like Sage or Xero or something else that allows you to move that data? And if not, what's the way of doing it? Can you pull things out into Power BI and run your own reports, etc.? If you're a really complex customer and you require some bespoke development, how does that work? Do they charge you for it? Is it done on a scope of work basis? And then looking at what might that cost be to you. And finally, legacy data. Now, this is always a complicated question for any software business because everyone writes code and everyone structures data in different ways. It's not always possible to import legacy data, but there should always be an element that is available to be imported. And the question that we would always be suggesting you look at and ask is, what level of data can you bring in? Is it static data? Is it things like rostering and scheduling information? And how is that data entry going to affect you moving forward when you need to bring on board new clients or you're moving your legacy data into the new one? How much effort are you going to have to put into that? I spoke about security compliance, but there's another side to that as well, which is looking at the compliance that you may have, that you are involved in terms of regulators, etc. So does that system that you're looking at really allow you to provide evidence and reports and exports to things like the CQC key lines of inquiries, quality statements, and what categories can you evidence to show that when you get your assessment and they come in and inspect you? How difficult is it for you to get the information that the CQC or another regulator is asking you for? Person-centered documentation we're seeing now really, really important. And of course, with the things like the NHS's digital social care record assured supplier list, to be able to get on that, you have to be able to evidence that you've got some standards and that your platform helps deliver person-centered care. So things like the PRSB About Me assessment. What other things are in there to help you create care plans, visit schedules, and assessments so that you're really offering that person-centered care. The Carer app, when your carers are out doing their visits, what sort of information can they access on their app? Can that help them with care delivery and medication administration, etc.? And moving that backwards into the office, what level of information do the staff then get? Of course, then there's other functionality that you need to be considering. So things like self-administration. Can you create your own care plans? Can you create your own assessments? Or is it very regimented in the way that things work? In terms of scheduling, do you need to be able to work in shifts? Do you need to be able to work in visits? Does the care app allow your carers to evidence better care delivery? Things like feedback, medication, observations, etc. And then what reports can you get out of that? And how can you filter that in a way that helps you with your business? Going back over the integration piece again, how integrated is the system really? Is it two systems bolted together, or is it one system that's been built natively and as an integrated platform right from the beginning? In terms of then updates, are they provided real time, or are they cached and uploaded later? And how does that work with no mobile signal? And as your business grows, and this is a really important thing to consider, as your business grows, will the platform evolve and grow with you? Things like adding new teams, visits, or shift types. And all of this then comes down to what level of support do you get during an onboarding process? What options are there for new staff in the future? So if you bring in new people on, what level of training, what level of help, what level of guidance is there for you? And what level of ongoing support is there? Do you get phone support, or is it all automated or online or through email? How quickly are phones answered? And as I said, if it's not just done through phones, then what level of response time and ticketing comes through the digital ways? Can everyone in the organization get support, or is it just nominated individuals? And that also becomes really important. It's nothing worse than when you phone up your internet supplier and they say they won't talk to you because you're not the account holder, even though you're the one experiencing the problem now. And when you're looking at software, that should be something that you consider. So then what happens when it does all go wrong? When it doesn't perform as expected? How can you get out of that? How can you extract yourself from the contract? How can you get your data out of the system? Are there automatic rolling contracts? Can you even get hold of that company to give notice? And some of these things you won't know about until you hit that point, by which time it can often be too late. But the question then is, looking at things like Trustpilot reviews, existing customer feedback, you should be able to get an understanding of how difficult this is or how likely that is to be a problem. When you read the terms and conditions, when you sign up with that supplier, is it easy to understand them, or are they massively overcomplicated? When you have overcomplicated terms and conditions, are you just hiding behind them? And how biased are those terms and conditions on the software provider? Are they fair to you as a customer as well? Because when entering into a contract, it should be give and take. Everybody should have an ability to see where they have to provide something as well, be it payment, etc., and where the supplier is responsible for most of it. So I hope that we've given you a lot of information around what you should be looking for when you buy a digital system. But more of that information can be seen within our ebook, which you can go and download by scanning the QR code. We have our head of home care, so home care champion, Marina Martin. She's written an absolutely fantastic guide on setting up your home care business and what you should do to be a success. So go and have a read through of that. If there's any questions that you've got, please put them in the Q&A or in the chat, and we can go through those now. But otherwise, thank you very much.
Thanks, Josh. So you can just go to our website and you put /ebook in, and you will find a link to be able to register for the ebook. It is free if you didn't manage to get your phone up to scan the QR codes in time. Obviously, if you have specific questions about the way our system is, about the way our contracts are, as to how we stand up against the things that we've suggested that you talk about, you are always very welcome to email us, and we can respond to that, give you a demo of the software.
Moira, just answering some of the questions that you've got. So the first one you've got is what makes your system stand out from the others? That's obviously a difficult question to answer because every platform that you can go and see has different features, different functions, and different ways of working. But one of the things that I'm really proud of is that we've built our entire platform together as one cohesive platform. So when we were talking about things like integration, etc., we weren't, we've made sure that we have built things that work together. So things like when we look at recording observations from the app, that goes straight into an observations tab within the client's profile. It's not in a separate system. When you do the scheduling, it's integrated into the client's profile. And that integration, that cohesiveness is what we see as being one of the things that stands us out the most and is the most valuable to our customers. In addition to that, the fact that over 80% of our phone calls are answered within 20 seconds, that's a phenomenal achievement for support and really helps you get the best out of the platform. In terms of errors in the MAR charts, medication names, etc., so we integrate with the NHS medications database. So as you start typing in things like amitriptyline, by the time you've typed AM, it's starting to show you a list of medications that you can go and pick and choose from, and then you can select the dose and you can write that in, and that gets given to the carer through their application. Linda, does our system have any forms that would capture a reablement journey? There are no forms that we have built for that, but we can help you build those forms through the form builder so that you can complete those yourself and you can tailor those to the business that, to the different types of reablement service that you're offering. Sal, in terms of then option for carers to add their own availability into the system, I appreciate that'd be very useful for you. We do have plans for a carer portal. If you reach out to our support team, then they can point you in the direction of our product manager, who will have a chat with you about some of the things that you maybe would like to see, and he can fill you in on some of the roadmaps, product updates that we've got planned for the next couple of months.
Rena asked about whether we have examples of forms and templates.
Yes, there are examples within the platform. So we've got things like MST, Waterloo, About Me, Assessment, etc. There's too many to kind of reel off right now, but our sales team can certainly arrange a demonstration that will go through those with you. So our uptime over the last 12 months has been in excess of 99.9%, which is amazing, and that includes scheduled downtime. As I said, most of our over 80% of our phone calls are answered within 20 seconds. So it gives you an idea of how responsive we are when dealing with queries and questions. Moira, your last question about does it allow carers to enter their annual leave requests directly? Currently, it does not, but that's one of the things that we're investigating through the carer portal, which is something that we're looking at building and is in our roadmap. Can you trace the client journey from referral to leaving the service and all the different elements such as reablement? Well, you can track things like observations, you can look at things like assessments, you can look at things like reviews, etc. So there would be ways of tracking some of that information. As to how much would depend on what level of information that you want to capture. Every business that we work with is completely different from every other business. Every business is different. So one of the things that you could discuss with our sales team, who would go through that in a demonstration with you and look at the different things that our platform offers.
Moira, it might also be worth just mentioning that on the blog there is a section under our public sector section called reablement, and that may well answer some of your questions there. And if you look in the resources section as well, there's a public sector brochure which may well be useful for you. I see that you work for NHS Highlands, so we would be really happy to talk more specifically about your questions going forwards.
And we could obviously also put you in touch with Mid and South Essex NHS Trust, who currently use us for their reablement service.
Yeah, we've got a bit, again, pushing you back to the website. If you look at the case studies section on the blog, we have a really nice case study on the Mid and South Essex Trust and how they've saved a huge number of patient days through using us for their e-enrollment services. So that got quite interesting on the question and answer front there. Thank you very much. We're nicely finished well within the hour, so thank you so much for your time. And as I said, we will have the slide deck and the recording will be sent out to you next week. We'll put the recording up on YouTube as well, so you can share that with others. If there's nothing else, thank you very much for joining us from me and from Josh.
Thank you very much.